Hey there, nurses. Hey there, nurses. Happy Monday. And thank you for tagging me in Sassy's video, sending it to me. I have received it. And let's talk about DNR and suicidal ideation. As most of you know, I was a prior investigator for a board of nursing. I've been a civil expert. I've been an administrative expert. So what does it mean if a patient self-harms and they're DNR? That's loaded, correct? I mean, there's so much to unpack there. And what is our duty as the nurse? As Sassy goes on to say, there's no hard and fast rule to this. And you'll even see physicians. I don't know if you guys have seen that article. I have read it a while ago that the physicians were talking about this, and they too have varying opinions, from the emergency room physician to surgeons. So this is a hot topic. Like Sassy goes on to say, when someone rolls up into the emergency room, I've worked lots of ER, and we don't have the same body of knowledge that they do upstairs on the inpatient side when they can see your actual DNR. No. When they roll up in an emergency room, they could have minutes to live. So if we do nothing, then they're not going to make it. And just like he says, it's easier to apologize than to, not be able to do anything, correct? He goes on to say as well that when was that DNR written? Was that 5 minutes ago, 3 weeks ago, 3 years ago? Because that is very different. What was the mental capacity of that person when they made that decision? Were they experiencing, suicidal ideation? Remember, suicidal ideation can be transient. So we have to remember that as well. So when was that actually made? And like he talks about, yes, overriding a DNR is considered battery. It's considered assault and battery, but was that made in sound mind and body? And that's not for us to decide as the nurses. Our responsibility is to, ensure that their autonomy is respected. And then, we could be down with all these, our ethical duties, beneficence. Are they getting the medical treatment for the diagnosis? Is it a mental health diagnosis that needs to be treated? If that mental health diagnosis and or the chronic pain is treated, would they still be suffering from this? If the medical condition was treated, would they still be experiencing this episode? And then like some of these doctors go on to talk about, or we even know, some of these DNRs are vague and are very specific. So if it says don't do chest compressions and no one had to do chest compressions, it was respiratory driven. So do you adhere to not doing chest compressions and intubate them? Or it says no pressors. Well, we didn't start pressors. We did chest compressions and we intubated them, but their DNR doesn't say that we can't do that. So what does the DNR actually say? Because those can be very vague as well and or very detailed. I was just talking about this the other day, and I believe I did a video about this. When a patient comes down, let's say, to the cath lab, when I'm working in the cath lab, you're not a DNR. When I'm working pre-op and we're bringing you down for any procedure, it doesn't matter. You're not a DNR any longer. And when I go pick up patients, especially when we're going down to the cath lab, I let them know we don't respect that. I reconfirm that. And I tell the doc, or if there's any questions about that, the doc comes and talks to the patient, because we don't know if the drugs and or the things that we have done can cause, an arrhythmia that we would have to, shock you for, or chest compressions, whatever it is. So when you go to a procedural area as well, a DNR is not honored. No, never. That's not how it works. So love to hear what people are seeing out there. I would love to know if there's actually any litigation against a nurse. Most specifically, if there's any cases, board of nursing cases against a nurse in this space. I'd love to learn about those. I don't personally know of any nurse that has been involved in this type of litigation on the administrative side, but I'm sure there has been. Unsure if there's any civil litigation or criminal litigation, but love to hear if there's any cases. So love to hear what you're seeing, what your policy is within your organization. I highly suggest that you check out the policy within your organization and also guidance from the board of nursing. So post in here what you're seeing in your facility, what the policy says, and then your board of nursing, so that we can all stay educated. Love ya.